Okay, hello and welcome to Fermenting Opinions. I am your host, David Papiden, and my co-host James McVeigh is not here tonight. He had to work late, so this is going to be a little bit stripped down, but it was a conversation I think we wanted to have, given everything that's going on. If you're looking at the title of this video, that we're talking about healthcare tonight, the healthcare bill. We're talking about the ACA, the fate of the ACA, and ACHA, ACHA. Also known as wealth care, also known as Trump care, also known as repeal and go fuck yourself. And here to talk about those things and maybe a better way forward is my friend Melissa, and she has had some experience, quite a bit of experience working in the mental health field. So she has some experience working in the healthcare field. So she has a little bit of background knowledge herself. And, we are also both a little bit on, sort of opposite sides of the political spectrum. So hopefully it'll be a good conversation. But first, my first initial thought is the ACA is pretty much doomed at this point. It's on borrowed time. Do you think that's accurate, Melissa?
I do. I think that I think the nails in the coffin for the ACA came when the large providers at United Healthcare, when they all started pulling out. There was no way that the ACA was ever going to be sustainable without that big money.
Right. Yeah, I think providers have been pulling out because it's not really a good bet anymore. Essentially, that these guys are here. They're companies. The company's job is to make money. Providing a service, making widgets, whatever it is they do. And if it's not, if the juice is not worth the squeeze, then why hang around, right? I mean,
exactly. It certainly had some issues from the beginning when people were having issues finding an affordable policy. I know that there were a lot of promises that were made that unfortunately did not come to pass. So a lot of people, especially people, once they reached that age of 26 and were no longer going to be covered on their parents' policies, found that they couldn't find policies that they could afford and opted to take the financial hit through a tax on their income tax return. And that was more affordable than the insurance itself. But I think that had that not happened, the fact that the major providers pulling out, I feel like it was like too fast, too furious. It was just kind of put together too quickly. It just really didn't have feet.
Yeah.
At least not. It didn't have the right. At least not the right sneakers on for sure.
Right. Yeah. It didn't have. Yeah. I say that a lot. That this thing needs legs on it. So yeah, feet is another way to. And it's really amusing that you've titled that with an awful movie title. that cages it well. Yeah. It's sort of an ugly beast, right? Because in order for the Affordable Care Act to work, you have to have providers of insurance, because these are private insurance companies. This isn't the government insurance. For people who are a little bit unclear on that. That you have to have providers involved. You have to have the money for it, and that comes from younger, healthier people, like you're saying, talking about, who are 26 or just being kicked off their parents' insurance, and being able to have relatively affordable health insurance. And when you say, hey, I'm young, young buck or whatever, I'm not going to have any kind of chronic health issue. I'm going to be fine for at least the next several years. I can't really afford that. I can take a tax, and really, when it came out, the tax penalty, essentially, if I'm calling it the right thing, the penalty that you had to pay didn't come immediately. It was only introduced after a few years into it. And even then it's capped. And it was only a certain amount, and it mounted up a little bit, but then it stopped. And if it's still cheaper to eat that than to pay those higher premiums, then obviously people are going to do what they need to do. It's going to save money in the long term. Again, but it's all a gamble, right? You're hoping that you don't have develop some or discover some chronic illness,
have a catastrophic accident, or
something catastrophic. Exactly. So it definitely had problems. And really what it banked on, and on on the high level, on the grand scheme, to me it still makes sense, and I still at least partially defend it for this reason. Is yes, young people are going to be paying essentially more than their share, and it's a little bit unfair. And I think when it came out, I would still characterize myself as one of these young people. Now, an older person might look at me as still a young guy, but I'm 36. I don't really feel like a young person anymore. I'm starting to get older, starting to get a little bit more concerned about, my health and, long-term needs and stuff like that. But the fact of the matter is, when you get older, you need access to this more. You need to, be able to pay for medical treatment because stuff, you get older, you have the too many birthday syndrome, stuff starts breaking down, right? It's not, getting old hurts, a little bit. So, you need these things, and that's what people are paying. That's what the younger people are paying for, is essentially to cover the older people. And then the obvious argument against that is, why should I have to pay for somebody else? If I'm young, I'm healthy, this and that. And to me, the argument there, the immediate argument is, well, one day you're going to be one of those geezers that is going to need, constant care. And really, end of life especially, that's where most of the cost of care comes from. That things are breaking down, their chronic problems are not going away, you're not getting younger. More things are not working well. You need, it's going to require more resources to take care of it and keep you going.
Technically, David, insurance, whether it be health insurance, homeowner insurance, car insurance, we all pay for each other anyway. That's how insurance works. We are in a pool of consumers, and we all pay in the hopes that we don't have to use it. Just because I'm paying into it doesn't mean that I'm going to use it. Like,
right.
I pay insurance every 6 months on my car. I haven't had an accident, knock wood, since I don't know when.
I was going to say, don't say it.
But if someone else that has the same company that I do may have an accident, and it's that pool of money that we've all chipped into that those coverages are coming out of. So I mean, I think, and I understand where people are coming from. I don't want to pay for someone else's insurance, but the thing is, you kind of already have been. So there's that argument.
Yeah. You
kind of already have been, because that's how insurance works.
Right, and that's, the idea is, if the ACA had legs on it that it needed, which I won't get into the expansion, but if it had legs on it to begin with, say me as a young person, when this thing, came out 7 years ago, 7 years younger, that was 29 or whatever, still a young person, still in that category of not really needing it the way older folks, are just as a matter of practicality going to need it. The idea that I pay into it my whole life, essentially, like a lot of other programs, that, when I get to that stage in life, I can say, look, I don't really feel bad personally, because, I've been paying really more than my share this whole time. Now it's my time, essentially, for someone else, to help, share that load, essentially. That was, that's what it was. That's what it was all about. So the problem is, to me, the way I look at it, the problem, and I'll say this as a person, I don't mind paying more. I'm one of the people who say, I'll take that on the chin, I'll bite that bullet. I wouldn't mind paying more, knowing that I was going to have that coverage and that security down the line. But I think of it generally as people being, I won't say generally. That's a little unfair. I'm at a financial level where I'm comfortable enough where I can say I can pay more. There are people in worse situations than me. They can say, look, I just can't afford this at all. It's easier to take that hit because I just cannot afford to pay this. I also need to caveat that I don't have any kids. I'm not married. It's just me that I'm looking out for. Okay, so I can say I can pay a little bit more than the average other person, but other people, they've got, they could have a family of 5. Guess what? That's ridiculously out of their range now. And so I definitely have sympathy. I can understand that.
Well, it's the same argument that people make with income tax in general. There are a lot of people that are on the opposite side of the political spectrum for me that always say, well, I'm happy to pay more in taxes if it means X, Y, Z gets done or helps, this community. That's fine. You always have the option, if you'll notice on your tax returns, you always have the ability to contribute more than what is required of you. But my question is, do you do it? Do you do it when I mean, I'm never such a bitch as to say to my friends that say, well, I wouldn't mind paying more. Well, do you?
Right.
I mean, that's one thing. You can also write a check to Uncle Sam at any given time of the year. They'll be happy. The government's always happy to take your money.
Sure.
My problem with the whole paying for others, or being penalized for not having insurance, or all of the chief complaints that everybody had, I don't think that it should be government mandated that you have health care insurance, because it's not like driving a car. We are all born and have been given life. We don't all have to or need to drive a car. It's a privilege that we pay for the vehicle and the insurance, right, and the maintenance.
It's not a have to, And the other thing,
it's a want to or need to.
Right, and also with car insurance, there are some people, who go their whole lives, never have major problems. Not too many, but not any kind of severe impact on the system. That you can never have a major accident in your life. You can never be in a rollover, pile up, whatever. Like you could go this entire time and contribute more to the system than you ever take out of it.
Exactly.
It's a it's definitely a possibility. With healthcare, you're gonna need it. If you're alive, you're gonna have health problems. It's inevitable.
It goes back, but that kind of goes back to the point that I was bringing up with you before we went live. Yes, everybody, I don't feel like the government has the right to tell me you must have health insurance or we're going to tax you on your next tax return. I think that is absurd. I think that it's absolutely ridiculous. But I get the whole, we all pay into a pool, we all get the benefit of using the insurance. But I don't think that it should be a mandate that, okay, well then we're going to penalize you by fining you. That's to me completely, that's pinning my arm behind my back and forcing me against my will to do something that I don't think that the government should be doing.
Right.
Now, as far as I kind of went off on a little tangent. Sorry about that. It gets back to everybody at some point is going to need health insurance or health care, and that's kind of my point with the semantics. No one is being denied. Hey, Lace. No one is being. Hey, lady.
Hey, Lace,
no one is being denied the opportunity to have access to healthcare. Like I was telling you about my broken foot and going to LSU Shreveport and getting the indigent care when I was out of work. No one is going to be turned away. No one is going to be denied access to health care. What we're talking about is health care insurance. Right. And so that to me is a, she's got a baby. Yeah. So that to me is a big thing, is how we have this, just the semantics of it. So that's where I kind of feel like a lot of this whole, well, it's a right. No, it's a privilege. No, it's a right. We all have a reasonable expectation that we're going to be seen when we need medical care.
Right.
I think what we need to refocus on is, what we're talking about is insurance coverage, healthcare coverage, not healthcare.
Right.
And in that case, I can see where some people get a little bit militant about, well, healthcare is a right. Well, that puts people like doctors and administrative professionals and janitorial staff. Who's going to pay if we are providing free health care? Who's going to pay the wages for those people that have to maintain the hospital, that have to run the hospital, that have to provide the coverage, that have to buy the X-ray machines, that have to all of these things cost money. So
right.
I guess that's the thing where I get kind of
and that's
been out of shape.
Sure.
It's not healthcare.
Yeah.
It's coverage.
Right. And that's where the argument for single payer comes in. If everyone is sort of owed this as a right, if it's something that we just ought to do, whether we're going to call it a right or moral obligation or anything else, we're not getting into that that sort of heavy-handed conversation tonight. But if people really feel that way, and it's in on a more practical level, it's something we know we're all going to need, right? That's my understanding is where the argument for single payer comes in, is everyone should just get what they need, and we all pay taxes, and that will go to cover the costs, And beyond that, I don't really know very much about single payer. I'm not here to try and defend single payer necessarily without knowing more. But to a point you made earlier about being penalized for not wanting to participate in ACA, right, and saying I'm not going to have healthcare coverage at all, and I'll just deal with it and pay for what I need to pay for because I'm young and healthy, or I'm hedging my bets essentially. You're saying, putting your arm behind your back and forcing you to say, oh, well, you're not going to do this. Well, you're going to pay this penalty essentially.
Yeah.
And I don't like it either, but I can understand the argument for it. That essentially,
people in the pool. You need healthy people paying into it to support the people that are going to be using the bulk of the insurance.
Right.
I get that.
Right. And
I guess it's the involuntary versus voluntary aspect of it that so many people, including myself, were kind of, oh, hell no, you didn't.
Right.
Yeah.
And I get that, and I balk at that. I'm sorry, Lisa, I'll let you jump in here in just a second.
No problem.
And again, in defense of that, and again, I can understand why it's an ugly, uncomfortable thing. But when you're talking about involuntary, you're balancing that against another involuntary. You're being levied this tax because you're choosing not to have health insurance. It's also involuntary on the part of people who are providing actual health care for you. If you don't have insurance and you decide, I broke my, not faulting you that you're between jobs, but
right.
Someone who's decided, well, I'm just not going to have health insurance. I'm going to roll up on a hospital and, hey, I'm uninsured and I can't pay. That's cost everyone else is eating. So
exactly.
the
That's
idea
the
is a way to sort of check against that.
The taxpayers, in my case, when I was out in between jobs and I had the broken foot and I got the indigent care from LSUS, the taxpayers picked up that burden.
Right.
So there's already that burden being levied on your average Joe taxpayer, and to have an additional tax, I think is kind of where that straw that breaks the camel's back comes in. It's like we're already paying, because at least in major cities there's usually at least one hospital that will take the uninsured and the unemployed, so that they can get the care without having to pay for it. And it is I don't know if it's the city, the county, or the state, or all combined that do pick up the cost of that. But to have that going on in conjunction with the mandate, that I think it's kind of like, to me, double dipping.
Wait.
Go ahead, Liz.
What are the two things that you're saying is double dipping? The mandate that will penalize you for not taking a part of it and for not signing up, and then what's the other part of it that you were saying is?
I think go ahead.
I'm sorry, go ahead.
I just want to make, so what are the two things that are being double dipped?
Yeah, you were right. It's being penalized for not having insurance coverage on yourself. You're being penalized via tax returns, and then most major cities or community or states having indigent care for those people that just come into the emergency room that have no coverage, that have no ability to pay. The taxpayers do pick up that already.
So, and you know what? That's like awesome points, because my little brother, he would consider himself a libertarian. You sound a lot like him. He's like you too. Like, he's anti-abortion. He's he's probably more. You're, to me, very like, in a good way, like sincerely in a good way, religious. My little brother is the same way though. Like, he wants to be a preacher, But my point is that he was complaining about two things that you just mentioned, and I agree with him on both things, and you. And it's that, he feels like it's not fair. It's like complicated, he said, to figure out like which one you want to go to. It's like there's not enough information to figure out what you're supposed to do, and then they penalize you for not doing something. Not to mention the fact that it is like a culture shock to the people, that are totally against it, to have to like go figure out like where the hell am I get insurance, especially young people who, by the way, like my friend Joe, who's also Republican, he's more Republican, points out on our page that, it's young, healthy people, they want to put towards investing in like college accounts for kids or to buy a first house, whatever. They should be able to do that and buy a less expensive plan than go have to like pick from like two different very expensive plans. It's like, it's not.
And I was telling David that very same thing. It's kind of like, how when you get your first car and you're not on your parents' automobile insurance, and you go get that fly-by-night cheapo insurance because that's all you can afford, but by God, you got your liability and you can get on the freeway now.
Right.
Yeah. exactly. It means like being able to like buy, if you're a, for me, this is embarrassing, I'm going to admit this, but for me, I've lived a life where I like carpe diem sometimes. So I'm carpe diem. So I'm just like, I'm going to go buy that dress and then like get cheap car insurance.
Yeah.
Like, go like, I might go 2 extra months with it, sometimes a year with an inspired inspection sticker and be like, but I didn't have to pay for it. I could go like do other stupid shit. And so like, I get it as a young idiot. I get it. Or not idiot. That's not fair. But as a young person, I get it. Because I've done that same thing.
Well, you have different priorities when you're 22 than when you're 32.
Bingo. Bingo. But the other thing you hit on is something actually my little brother hasn't said, but that I agree with. I've heard other people say, and it's the whole concept of, you know, beforehand. I remember, because I was Republican at the time Obamacare was like first proposed, people on the Republican side, and I agree with them about this, or I did, is like, what do people, because the argument back then was made, well, you're letting people die. It's like, no, that's not true. People that really need emergency medical care can go to hospitals and they will be accepted in their emergency room. That's the way emergency rooms work. As anyone who's ever showed up with like no insurance in the flu has seen, everyone that has a real emergency gets through. So I understand that argument too. Only though until now that healthcare has become a battle and people are talking about it in terms of like, should they be entitled to it or not? Like, is it a right, you know, argument that everyone should have? It's the people that have cancer or some type of like chronic disease or some like type of thing that, and I'm gonna get to another part of this in just a second, but I think people that have like one of those incurable diseases, they, you know, should be able, like, I hate to see some mother have her son or daughter see someone in their, anyone to lose anyone that they love to a disease that the person couldn't afford to fight is like so tragic.
Well, you know, I agree. You're absolutely right. And
we were talking about this before the show, yeah.
Yeah, but here's the thing. I think that there are other things that we need to bring into the equation. It's not, this is not just about providing insurance or providing health care. I think the problem is not necessarily healthcare coverage. I think one of the main problems is how inflated things are. The price of prescription medications, inflated.
Yep.
The price of medical equipment, inflated. There is no reason on God's green earth why I should pay $20 for a box of fucking Kleenex in the hospital. There's no reason for that.
Right, yeah. No, that's... I think the upcharging and, you know, the service charges that come in, a lot of it's, you know, it's egregious.
And I've got a very good friend who's a healthcare administrator, and he's retired now, but he can sit there and tell you horror stories about, you know, elderly women trying to, you know, come in and explain why they can't pay their bills, and looking over some of the charges on there, and it's just obscene what they charge for a freaking bare baby aspirin.
So, and my question is, why are services so expensive?
It's my understanding, and please feel free to jump in and correct me. It's my understanding that a lot of the reasons why those things are, you're talking about, you know, baby aspirin and a box of Kleenex being, you know, some egregious amount, is that they're putting in these upcharges because they're trying to cover the cost of operations of the hospital in general, because they're trying to keep their doors open, so they have to charge, you know, crap tons of money for things that don't really cost that much to cover other costs elsewhere. And to me, my understanding is that comes back to, you know, uninsured people rolling through those doors, trying to get critical care, and really not, you know, ethically being able to deny people, you know, service in these situations. You know, they're eating that cost and they have to make it up somewhere else. Now, if this is happening another way, someone explain it to me, but that's my understanding of why that is the way it is. And it's an ugly, horrible thing, but that's why.
Well, here's the thing, though. Once you've got your hand in that cookie jar, do you think you're going to pull it out? I mean, once the hospitals figure out that they can charge these astronomical fees for things like that, even if they are getting subsidized from the government, to, you know, or if we've got a you know, patient base that's got coverage now, do you think they're going to stop charging those outrageous those outrageous costs? I don't think so, because once you get used to having that security and that padding, you're not going to be so anxious to let it go.
Sure, and you're probably right, but I don't know if most hospitals have actually hit that point. Especially when we're talking about rural hospitals. Hospitals that are terrified of what happens. If Medicaid gets cut, and most of what I've heard is pretty much every hospital association, in the country are very much, and this will maybe provide a decent segue, are very much against this new healthcare, but because of these cuts, they're afraid of closing their doors. Because if they have to charge $20 for a box of Kleenex, or who knows what for a baby, Bayer aspirin, and that's on top of the money they're already getting from Medicaid, and if that that gets cut out and they have to shut down, it doesn't seem like we're at the point where they're just enjoying the lavish excess of price gouging the hell out of people, for the fun of it, so they can run away with giant bags of money to the bank. We're nowhere nearly there, and I agree. I do agree with your cynicism a little bit towards if people are so used to making this kind of money, why wouldn't they continue to do it? Yeah, maybe, but I don't think really hospitals are anywhere near that point right now. That's maybe a future problem, but right now, I don't want to see a bunch of rural hospitals close, and that's why I and pretty much everybody is strongly opposed to this new bill. So we've discussed a little bit, some of the the ups and downs of the ACA, why we look at it like sort of like a three-legged dog with diarrhea. That it's still a dog, it'll still bark when there's an intruder, but there's so many problems with it, right? I hope your dog has all four legs, Lace.
Yeah, I know. I was like, a dog.
Right. So the ACA is an ugly thing. Republicans, it's been their mantra. Congressional Republicans, not necessarily just everybody. Get rid of the ACA. Get rid of Obamacare. Kill Obamacare. Kill it. Ever since its inception, and it's this whole idea of repeal and replace. They're very much on board with the repeal part. Gotcha. I understand the criticisms. A lot of them are pretty fair. I think some of them maybe are not particularly well thought out, but a lot of them are fair criticisms. It's an ugly beast. So my attitude, trying to be as open-minded about it as I can, and say, okay, let's do something better. Let's do something that's going to be better because everybody's going to need healthcare at some point in their life. The idea behind a healthcare bill is, via insurance, is affordable access to care. Let's do something better. And they came out with the ACHA. I don't even know what the acronym stands for. And it's garbage, as far as I can understand. That it's everything you don't like about Obamacare, but it's worse. This is what we've got instead. And there's a version of it that is passed in the House, and it is stalled currently in the Senate. And I'm just sort of asking you guys, why did Republicans go with this thing? And what do you think of it? And what could be better? Because obviously it's grossly unpopular. My understanding is that at least as of March or April, I believe there was a polls taken, and it's got the bill itself has a 17% approval rating among the American people. 17, to me that's don't even try. But again, these are elected officials; they don't really care what little people think.
Well, I left the Republican Party years ago because I got tired of the infighting and the fact that the Republican Party didn't seem to be any better, worse, or indifferent than the Democrat Party, and so I started. That's about when I started realizing I was more on the libertarian scale of things, more right-leaning libertarian, of course. Mm. But I think personally, from an outside perspective, being no longer part of that party, the Republican Party, I think part of the reason why is because there are two factions within the Republican Party that can't stand each other. So they're never going to agree on anything while they're being silly and butting heads. You could tell the Freedom Caucus that the sky is blue, and then the what they call the Rhino caucus or whatever, the rhinos that are, the others, they're going, no, hell, it's never been blue. It's always been green. You're never going to get a consensus.
Did y'all hear? Because y'all have been on this longer than me, I'm just coming in from a dinner, and I'm just saying that I saw a text on my phone. Did y'all know that John McCain, speaking of the far end on the opposite end of the Freedom Caucus, Melissa, did y'all know that he has a brain tumor? They just found out that is a brain tumor. I think it's
glioblastoma.
Yeah, that's my understanding. I saw the abbreviation for it. Yeah, that's, as an aside, it's healthcare related to all of this. McCain is a guy that I've always respected. I haven't agreed too much of things that he said. There's certain times he's made points, that I think this is, a little more broad-based. Like, we can all get behind this as Americans, that we care about treason, we care about certain basic things, we care about, sort of truth and honor and dignity. These to me are sort of American virtues. And, I've always liked him for that reason, even if I don't agree with him on a lot of other things, to be honest. Yeah, and just sort of to step away from the healthcare debate for a second. Yeah, diagnosed with cancer, brain cancer, super sucks. And I'm just sorry to hear it. So.
Yeah. Man, it's like, imagine. Oh my God, that's a perfect thing though. Imagine if he was poor.
Right. Yeah.
Who would pay for it?
Right, and this goes back to the the earlier part about being uninsured and who shoulders those costs. And this is where the ACA came from in the first place, right?
But could he just go to a hospital? I'm serious, hypothetical, because I don't know the answer to this. But let's just hypothetical. John McCain is unrich, non-senator, regular Joe Blow McCain, gets brain tumor at his age. What would happen under old nothing law, which is allegedly equal? AKA repeal and replace, or just repeal completely without a replacement, and just go back to like what if that's even possible.
I hear the short answer, as I understand it, is you're not going to get your cancer treated in an emergency room. If you were podunk and have no insurance, you can roll up in an emergency room like when you're about to flatline or something like that, and there's you're in some kind of horrible pain or some acute thing is happening, they will treat you. But in terms of long-term care, you're not going to get it without the money or without insurance. Medication, that's which again, Melissa, unfair, but the political atmosphere I grew up in is that Republicans felt that you should get better or die. And that's their approach to healthcare, and I get that it's pejorative and hyperbolic and all these things, but like a lot of people would be stuck because a hospital can only do so much because you're talking about acute short-term solutions. It doesn't really deal with chronic illness, and that's these are the people being left out in the cold when you're talking about people are going to die when they don't get healthcare. This is what we really mean, that and we talked about this a little bit before the show, in terms of, yes, you can get you break your foot, you get shot, you've got meningitis or something like that, you can go to the hospital, they're going to take care of you, right? Whether or not you have insurance, I'm not going to turn you away. But if you have an ongoing problem, there's only so much they can do in the short term, and in the long term, you're essentially too bad for you. You should have had more money, kind of thing. That's right. What it's going to come down to, and to me that's egregious and immoral, and that's and that's the scary thing about ACHA.
Here's a suggestion. I know, and correct me if I'm wrong, I'm under the impression that when the ACA was being drafted, that it was basically lawyers that put that together. How about we bring people in from the medical community, people that work in the insurance industry? How about we bring people in to the discussion that actually know how it does and should work, instead of having, and no offense to attorneys, we definitely need to make sure that everything that's being drafted and created is legal and it's in its right place. But let's just bring some people to the table that might have a little bit more expertise in the areas that are actually going to be affected. What we're talking about are two industries that are holding the hands. the medical industry and it's the insurance industry. Those are the two right there that need to be heavily included in the discussion as far as a solution. As long as you leave this to congressmen and women, the vast majority outside of, I can't think of anybody off the top of my head besides Rand Paul that has any background in medicine. So we're talking mostly attorneys that are trying to put this together. And while valiant, we need to bring other, the two facets that are affected the most into the equation.
I think that's absolutely right, that you should seek out the wisdom of consultants, or not even professional consultants, like just real deal, like medical professionals and insurance professionals and people that are members of organizations of, I don't know, but the national organizations of doctors or of surgeons, or, all these professional organizations that take folks that are sincerely committed and esteemed and that donate and that are a part of all this to really join and be members, should come in and definitely advise the people that are working on drafting those bills. I completely agree. I can tell you as an attorney in my practice that when you get into things that are, and this is different than the Senate, but I'll get to why I think it's similar in just a second, in an adversarial type of practice, which lawyers do that aren't legislative, you've got to take a position that supports your side. And so there are folks that are professional, experts and stuff, that either side can get an expert. So I don't know if it's really an attorney thing. I would think what you're saying, Melissa, is you're looking for someone who's gonna not even be adversarial about it and consult these folks for the legitimate purpose of using their knowledge and wisdom to help guide us work together to pass something that works.
Exactly. That's exactly what I'm trying to say.
Yeah. And I agree. I want the same damn thing. And and I can tell you from a more liberal, I guess, point of view, it's so funny because I hear what you're saying, and I'm saying the same thing, only differently. And the spin I guess I've put on it is okay, fine. Obamacare, though, in principle is the right idea. It is, everyone should be able to not look at life and be hindered from the pursuit of life, liberty, or happiness because they have to think about, oh shit, I can't afford cancer treatments, or my child has cerebral palsy, or whatever it is. It's just my child doesn't get the same quality of life, and I don't get the same quality of life, and I have to file bankruptcy, or whatever horrible, sad thing you have to do. And I get the whole libertarian part of that is being the defense, in essence, the defense of not having the government. It's the liberty of not having the government in our business. But I think some things are as simple as should we have an interstate? I think we should all should have access. I do. I think we should all have. It should be an expense of the government. We figure out a way to fucking freaking pay for it. But
you don't have to mind your language here. It's fine.
I just think that. But at the same time, that is the principle, right? Which is why I think Obamacare is good. What Melissa is saying, which is very thoughtful and intelligent, is that we have to be able to figure out how to do that in a way that's not gonna there's bad ramifications of Obamacare that need to be fixed. And
we talked about that a little bit before you jumped in, actually.
Yeah, there's a way to sort of target what's wrong with Obamacare and fix that. And I hear it coming from middle class people that are talking about, well, I had to pay all these premiums or my costs went up. How did your costs go up? And let's analyze that and figure out why their costs went up. How can we fix that problem?
Right. And I think in this may be, possibly inaccurate, but I've heard a statistic quoted. There was something like 47% of Republicans were actually in favor of fixing the ACA instead of getting rid of it, to have the ACHA or what have you. And you were also talking about earlier, to the point about bringing in medical experts and things like that to talk about, how to fill these needs with regards to insurance, and what's really going to work. Talking about bringing real qualified experts. When ACH, and obviously the partisan that I am, I definitely have a bone to pick with Trump care / try and care / wealth care / repeal and go fuck yourself. All of those things that essentially people in the know have universally come out against this. When it first came out, Breitbart media was like, no, this is a bad bill. When literally everybody and their mother comes out and says this thing is awful, this is a rare moment of consensus in America, and I feel like it's been ignored by Congress. That is hilarious watching you, by the way, fetch the wine glass and come back around. It's like the Blair Witch Project with alcohol. You'll be standing in a corner and the camera falls to the side. You'll hear the noise. But anyway, yeah. So hospital associations have come out against it. AARP has come out against it, and these are people in the know. They know what essentially the relative interested parties or constituents are about. And they're saying this thing is not going to work. This thing is going to kick people out of having access to care because the costs are prohibitive, right? Melissa, I feel like you're disagreeing with me there, physically.
Well, just the thing about it is that there's so many opinions. There's so many. Some are just absolutely asinine, and some are very valid. And it's not that I'm disagreeing with you. It's just I'm kind of frustrated because I think that the people that are the most vocal are the ones that don't understand that there are no easy solutions.
Right. That's and it's funny if you guys look when this thing goes to YouTube when it finishes out. I titled this episode, "What do we want? Healthcare. How do we want it? No idea," because and that's the title of it because we can't. We all know that we want to have affordable access to healthcare. No one's asking for free stuff because nothing's free, right? I think everyone understands that. How are we going to do this? How are we going to make it work? It's a basic human need for everybody, right? Everybody's going to need healthcare. How do we do this? How do we make it work? Nobody can agree. And even with we have the Republican-controlled Congress, and Melissa, you pointed out earlier, even they can't agree because you have sort of more what some people might call rhinos, or as I like to call them, moderate Republicans. That they have one opinion on it, and that's where you get these defectors like I think it's Collins and Murkowski, and there's at least one other, and I can't remember the name off the top of my head, that have said no to the latest round of the Senate bill, and they said no, we can't do this because they're more moderate. They're saying, look, this is not what my constituents want, and sort of. Reading between the lines is if I vote yes for this, I could lose my seat, in the next election. That's the cynic in me. But like they're saying essentially this isn't what my people want. This isn't what people in general want. And then you have the people on the far right who again fall back to the government screws up everything. Government should have no role in healthcare. Let the free markets decide. Let's some version of that more competition will be better for everybody and drive down costs, and let's keep the government out of it. Let's not have a healthcare bill, and these two sides can't reconcile, and that's why we're having trouble they are having trouble with a bill that even they can agree on, even when they hold the majority in both the House and the Senate, and that's why this thing isn't a done deal yet.
Right,
Lace, you seem like you're chomping at the bit. What's up?
Me? No. Let Melissa go first.
No. I'm good.
I mean, I guess one of the things you brought up is like, I think that everyone, this is the first issue I've heard in a long time where people are being very, very like reaching across the aisle, and the only thing that's continuing to like wreak havoc is the remnants of partisanship. And I just want people to think sensibly and just go with what they think is right. And hopefully bring in some smart people like Melissa suggested that are also nonpartisan, and maybe we can just like work this out. And honestly, even as someone, like, I'm willing to look at it like it's the normal rational heads that are coming in and resolving this problem. And I don't care if that happens under Trump's reign, because like I just want it to happen. I'm like listening to the people that are upset on the right, and they're just like, what? A lot of the shit I don't agree with, but when it comes to healthcare, I listen to them and I'm like, wow, the things that they're complaining about now is stuff that other people have complained about in the past that I can relate to, that I've complained about for other things in my life in the past, and I can relate to that. And so I just want us to come to a solution that makes everyone happy. And I think that what we had in the first place before Obamacare was not good. Apparently, from what I'm hearing about Obamacare, there's a class of people, there's not a class, but there's a subset of people that are suffering, and they're not the billionaires that are getting taxed. They're the middle class people like me. And I just think, well, how do we, help them? And there's got to be a fix. Whether it's at whatever level it's at, whether it's from their job creation to like make more money to, I have no idea what level it needs to be fixed. But I can tell you, as a bankruptcy lawyer, I've been seeing a lot of hospital bankruptcies, and they're in rural areas. And it's these like, I know that there's like long-term acute care facilities that are suffering right now because like the regulations for what constitutes a long-term acute care patient has changed, and it's just like messing with these people's money. So rural hospitals are failing. There's a lot of rural hospitals that I see that are having difficulties because I don't know what, but it's like these smaller hospital units, or sometimes like there'll be these big holding companies that like purchase a lot of different smaller hospitals across the United States, and they're all like having difficulty financing right now. So I don't know what's going on with healthcare, but it is affecting some of like the what were supposed to be like little small hospitals that grew into bigger ones. And so definitely healthcare is seeing its fair share of failure in terms like on a healthcare industry, generally speaking, type of plane, if that makes any sense. But anyway, I guess, so it's not just the middle class people that are failing, it's also the hospitals themselves that are failing. I've also heard people say that insurance companies are failing. So, if Obamacare has created so much failure, then fine. But I still don't think we should ever go back to, well.
Yeah, the remark I made was the get better or die, Ebenezer Scrooge, perspective on healthcare. That that's, to me, that's where the ACA came from, Obamacare came from in the first place, to say, well, no, that's not really acceptable. And again, most opponents I've heard of this in terms of the lack of affordability. What would it take to make it sustainable? The big criticism is, fixing the ACA makes it more and more like single payer, and that's bad on the grounds of socialism. Is all I've really ever heard, and I don't know much more about it. Again, when I came out earlier before you came on saying, look, I'm not really going to defend single payer. I don't know enough about it to be particularly conversant. All I know is that it's treated like the boogeyman on the right, and I don't really fully understand that. Beyond that,
we need James on.
We need what? James and Siobhan. Yeah. That's the always teased, never delivered on deep dive debate, which we're not going to have tonight because we're interested in practicalities here right now tonight on Fermenting Opinions. But yeah, just moving on with something you touched on. This is a problem that we all have. This is a problem that we all want solved. Where are the experts in this, and why are they so, from indications I've been given, why are they so far from what Congress is doing right now? And even that, given the stall with a straight repeal, which I think was the latest thing that Mitch McConnell came out with, saying, let's just do a straight repeal and see what happens after that. And before that was, let's do the repeal and replace with this ugly, pernicious thing that, according to CBO scores, depending on all the different versions of the bills, the Congressional Budget Office, which is a nonpartisan bunch of bean counters, basically, is my understanding, and they come out and they look at the over-under of the effects of a piece of legislation, and they say, well, this is what's going to happen, as a result. And these aren't people who have a dog in the fight, as far as I understand. And they're saying, based on the different versions of the bill, we're looking at between 22 and 24 million people being kicked off of their health insurance, right, of these bills. And my understanding right now is, for all the costs and ugliness and how truthfully hard it has been on the middle class, Obamacare has been, that we've got some 20 million people that have coverage now that didn't before it came out. And that's sort of the big benefit, and you can't be denied for pre-existing conditions and all these things. But CBO said basically lots of people, basically more than were not covered before, are going to not have health insurance because of this thing. That this isn't going to be good for people who want health insurance. What's where we move from here, because people, the Republicans in the Senate, have said, well, no, we don't want this. And with regards to McConnell's floating the idea of a straight repeal and not replace, the Republicans said, no, we don't want this, or at least enough of them. And now Trump came out, I believe this morning, and said, okay, well, now what we're going to do is we're not going to essentially,
we're going to let it fail.
We're going to let Obamacare fail, and by not supplying the funding for it. This was a part of the problem with the Medicare. I'm sorry, I'll let you talk in a second, Liz. Here in Tennessee, and I know this at least as far as Tennessee's concerned, and I believe there was at least a dozen other states that refused a Medicaid expansion, which made it affordable and made help provide funding to keep to maintain like rural hospitals and things like that, to put legs on. We were talking about putting legs on this thing to make it work. If it's basically castrated financially, yeah, guess what? It's a bad bet for insurance companies, and it's too expensive for the regular middle class people to pay for it. And you go, oh, it's awful, it's a horrible thing. And in my, again, being the cynic, going, this was the design of the Republican agenda here, to say, what we'll choke this thing out of money and then say, look, Obamacare sucks, it's failing. It's time to repeal. And people, feeling that the pressure on themselves as individuals, and seeing and taking that hit personally, they're going to agree with that immediately. Most people would, if you don't pull back the curtain essentially on why that's happening. This is something that's been invited upon ourselves by having people in Congress that we do. That's my impression. Somebody push back or add to it if they want.
Well, so I'll just go real quick, because I need to consult. I have to ask Melissa a question, because I agree with you that first of all, what does that mean? Whenever you said we're just going to let it fail, and you just gave some really good examples, and I wonder, like, politically, what does that mean? And so my question is, what do the different sort of subsets of, like, because I consider, like, the right sort of like your alt-right, and Republican is all kind of Republican, but, like, libertarians kind of to the right, but, like, libertarians, which are very, like, small government, and like, what does everything, but I still consider, because I learned this on the show, that the libertarians are kind of to the right. Because I used to always think of them being to the left, but y'all definitely corrected me on that, and I agree.
Well, there are some left-leaning libertarians too, though.
Really?
Oh yeah. I mean, libertarian kind of straddles the fence at a lot of issues. but you can lean more liberal or more conservative given any particular topic.
Okay.
This, if I can chime in just briefly and to speak on behalf of James, to channel James just for a second, I think that's why he's often by conservatives maligned as a liberal. If that's to him probably maligned because he's
definitely
he's
that's
he's
the only Jody that's maligning him though.
To do what now?
I said that's usually only Jody that's maligning him though.
Well, yeah, Jody and sort of Jody's a friend of ours, but he's part of another program. Always welcome here. I don't know if that'll ever happen, but yeah, that is oftentimes labeled as a liberal because he's for, say, like legalization of marijuana and pro-gay marriage and stuff like that. So for a social conservative, the idea of someone being for that, just being very sort of simplistic in their view of a political spectrum, that boom, that makes you a liberal. James is very much not a liberal. And I'll say this in defense of him, essentially. And also, it's my way of distancing himself, because I am a liberal. His attitude towards, the Constitution and rights versus liberties, it very, in terms of, and also in terms of legal interpretation of originalism and textualism, things like that, and the political and legal outcomes of that, puts him very much on the right. And the way he looks at that.
Oh, by the way, David, your email just now came through.
Are you serious?
It just now came through.
Guys, I am not, anybody who's watching this right now, or anybody who will watch this, I am not a tech wizard. I am someone who's got a big mouth and wants a platform for my ideas and those of the people around me. Because, I want us all to come back to the table, but I am not a tech wizard. So I really struggle with podcasting and making things work on a tech level. So yeah, we this thing might have a few warts on it, and we're gonna try and iron those out over time. But for now, we are what we are. So sorry.
We're just a little motley crew of people with big mouths.
Exactly.
We are who we are. It's like ACHA.
Right.
I don't.
One thing I did want to contribute, David, when you were talking, we were all kind of rattling back and forth about solutions. I think what needs to happen is, and I might be naive in trying to nutshell this, but it sounds to me like the biggest issues or concerns that each party is having, whether it be insurance, healthcare providers, or politicians, the biggest issues that I'm seeing is cost. What is this going to cost me? How am I going to be able to function in light of the expense? So what would make this work out well for all parties is, how do we make insurance more affordable for the consumer? How do we make health care coverage by way of, physician, nurse, whatever who's caring for us? How do we make sure that they get paid what they deserve to be paid? How do we make sure that the hospitals are able to operate on what their overhead costs will allow? And how do we make sure that all of these entities stay profitable to continue to provide the service? And what it sounds like we're trying to do is not really look at how to marry all of those pieces to make sure that they're working in conjunction. We're just trying to ram something through without looking at how everything this cog has to be working at the right speed to make that band twist this cog at the right speed to turn that one. It's a machine that we've got to kind of look at all of the pieces and parts to make sure that no one is going underwater, no one is going bankrupt, no one is going without coverage, no one is going without a paycheck. We've got to look at the ways to make sure that all of the entities involved are able to turn a profit, because let's be honest. Businesses don't exist to be charitable. Businesses exist to be profitable. And hospitals are a business. Insurance is a business. It's all a business. But we still need to make sure that they turn a profit enough that they can hire qualified people to provide the good quality of care that we have and deserve. But we also need to make sure that we're not being raped over, the insurance premiums, or that we're having astronomical fees applied to a Band-Aid when we go and get stitches or something. So it's all about money. How do we fix the flow of money between all of the parties concerned? And I think that if we had people, maybe we need to bring in some economists as well. Maybe we need to go and get some actual, economists to sit down with the hospital staff and administrators, to sit with the insurance CEOs, and to sit with the congressional leaders that want to draft this bill. Because at the end of the day, the bulk of the bitching is about cost. What's it going to cost me? How is it going to affect my bottom line? It's about the money.
Absolutely. Yeah, it's, as the trope is true, follow the money and all these things. You brought up good points and things that we had touched on a little bit earlier, is that if you are a healthcare provider, if you are a doctor, if you are an insurance company, if you're still operating off of a fiduciary responsibility, right? That you have, right. If you're a company, a business, or whatever, that you have to make money. That comes first. If you're doing it by providing a service, if you're churning out widgets, whatever it is you're doing, if the primary goal is to make money, providing care, giving, meeting this need that we all have is always going to be secondary. And I think that's, that's sort of the deep-seated problem with a profit-driven, healthcare and insurance system is, the money that's involved in it, is making this what it is. You can draw comparisons to politics. So long as there's money in politics, people are always going to be driven by the money rather than doing, say, the right thing necessarily. You see, I see a parallel, honestly, between the two. And I don't want to get off on a rabbit trail on politics and money and dark money and all that crap. But with regards to healthcare, coming back to sort of the central point, this is something that we all need. It's non-negotiable in our lives. We're going to have health problems. We're going to need health care. And do we demand this of providers? And essentially when we go to a hospital, that's what we're doing. Whether or not we have the ability to pay for it ourselves. And how do we make this? How do we shoulder that cost? How do we share that? Well, see, I'm presupposing here that we should share that burden, and it seems like the only way to do that. Failing that, I don't know a better way. It seems like wealth care really is just sort of a cynical jab at the idea that we should be helping to take care of each other. Because as far as I know, and again, bringing it back to, wealth care, Trump care, whatever you want to call it, that it's all it is a stripped down version of Obamacare that's going to cut Medicaid over, across the years, going to kick people off of insurance, over the next several years, and provide a big ass tax cut to wealthy people and corporations, because the tax was built in Obamacare to pay for these services. And basically it's just undoing all of that and saying this is going to be great for somebody, but I really don't know who. And we don't really, I've actually never met a champion of this thing who has a concern for, for healthcare or for affordable health insurance. And again, and definitely not trying to put you in that corner, Melissa. I know you are the right-leaning, person here. You don't seem like you're any more of a proponent of that than anybody else. And again, I agree with most of your criticisms of Obamacare, of the ACA, but it doesn't seem like this is a better way forward. As a not necessarily a Republican, but as a right-leaning person, as someone who has strong libertarian leanings, how do you feel about it? Because I think that's one thing I haven't maybe asked tonight. How do you feel about what they're doing? And is there something you would rather see them do? How does this thing have any support to you? Because it doesn't seem like anyone wants to defend it.
How do I feel about The ACHA is what you're asking?
Yeah.
And what currently? Well, it goes back to what I've been saying. I think that having a room full of senators is not the way to address the issue. I feel like the biggest asset to actual resolution and fixing is consult with the people that are part of that industry or those industries. We're missing out on that wealth of knowledge. And I just, recently, mentioned adding in economists too, to figure out, how do you budget this better? How do you wade through the weeds and satisfy the aspect of cost versus what you provide?
Yeah.
I feel like I feel like what's happening right now, in all honesty, and I'm sorry, my eyes are driving me crazy. I feel like what we're doing right now is trying to do an Obamacare light, and it's just making the same mistakes that Obamacare did by not consulting with hospital administrators, with physicians, with insurance CEOs and executives, and with people that know how to make money work the way money should work. Those are the people that need to get involved in Congress, because at the end of the day, I have absolutely no confidence and no faith in Congress. They are there to depending on which side of the building you're working in, either every 2 or every 6 years. All you're there is to pander for votes, and you're not going to do what's right by your constituents. You're going to do what's right for you to keep your vote.
Yeah, that's they don't want to lose their seats, and that's. By the way, it looks like we lost Lace. Hope she comes back. But I think you touched on a really good point there. One reason why this thing has as many votes is what it does, and that it, in the Senate it's only losing by, 2 or 3 votes, to take it, beyond that threshold where Mike Pence can break the tie, and it's because this is the struggle they face, is that and within I understand the RNC's, I think the finance chair for the RNC is Steve Wynn, who owns a giant ass casinos in Vegas. Right?
Vegas, yeah.
He's a rich guy who stands to benefit from the passing of this thing. And what he's doing is he's going around putting pressure on these people to try and vote, strongly suggesting that these Republicans might get primaried, which, if people are not familiar with the term primary,
I know what it is.
I know what I mean. It's I sort of say this for the benefit of anybody who might be listening in, that that
I forgot we might have an audience.
Right, we might have an audience one day that say you're a Republican, and the party is going to fund someone to challenge you in a primary to get rid of you because you didn't vote the way the party wanted you to. I'm not saying Democrats don't do this too, but in this instance, that's the fear. And this is a problem with putting money in politics, and that's an aside. But basically saying, hey, I'm a rich guy with big bags of money. I stand to benefit from this thing. If you don't go the right way, you might lose your seat, boy or girl, as the case may be. And it just comes down to balancing that fear against, if we're being practical, the fear of, well, if I do vote for the repeal and replace, in whatever form it is, that the base that I have, that I'm not secure enough in my seat against Democrats and against people in the middle and on the left. I'm not secure enough, in my place to piss all of them off at the same time. I might lose my seat anyway. And so, there's certain people who are riding in this margin who are very much afraid, that you're damned if you do and you're damned if you don't. The Republicans will get rid of you if you don't vote with the Republicans, and the Democrats will get rid of you, if you vote the other way. So, and that's the ugliness of this thing. If something that is broadly unpopular, it is being driven by party politics. And that's why we are where we are, truly, I think. But yeah, just go ahead.
Yeah, I'm sorry. Go ahead. Please finish.
Oh no, just I was just going to say that's it's not a satisfactory solution for anybody, and if you and really, because I think it's probably about time to put a bow on this thing, to look forward if you are a person on the right, look past this mantra of we must repeal Obamacare, because I think it's become very much a lightning rod for people for how ugly it is. But don't be so set on repealing Obamacare that you're willing to create conditions that are actually worse than the things that you didn't like about Obamacare. If you give yourself a good skeptical look at the over under of the result of this thing, if Obamacare is actually better, as much as that might be appalling to some people, if it's the case that it is, and it really looks like it is, maybe it's time to pump the brakes, guys. That's my thought. Melissa, do you have anything else to add?
Well, the only thing that I can say is with regard to Republican opposition, a lot of times what I hear is, well, I don't want to have to pay for anybody else's coverage. And this goes back to what you and I were discussing before we went live. Insurance already works that way. We all pay into a pool, whether it be, homeowner insurance, healthcare insurance, automobile insurance. We pay into a pool that we all use, maybe. But we all pay into a pool, and this is not my insurance. Say you go through Farmers Insurance, the policy you're buying, well, you know what? Someone else is also contributing to that same pool of policies. So when people complain, well, I don't want to have to be paying for somebody else's health care coverage. Well, guess what? If you have Blue Cross Blue Shield right now through your employer, you already are. Yeah. Your portion of what you're paying on your out of your paycheck every 2 weeks, you're already contributing to that pool. So that right there, I'm tired of hearing that little canard. I'm tired of it. We're already paying into a pool to cover each other. My biggest contribution to put a bow on it is research your facts. Research the information. Don't let your friends or your family influence your thoughts without you giving it some thought yourself. And by God, don't let the mainstream media fearmonger the hell out of you, because I'm telling you right now, there's a lot of that going on too. So there's a lot of hyperbole on both sides. There's a lot of gray in the middle, that if you take the time and do the due diligence to the research yourself, you might come out of it with a different opinion than the one you hold now. And that's kind of where I was. At first, I was a militant repeal, replace, when Obamacare first came out in 2009, 2010, or when it was,
I think it was 2009,
yeah. 2009. But I was still a Republican in 2009. Now that I've kind of, grown up, looked at the evidence, taken some time to understand, what I believe, my opinions have changed, my perspectives have changed. Just take a minute and just research the situation. Don't just fall blindly into lockstep with the catchphrase.
Yeah, no, and I hear you, and it's. And I'll take a moment here to break party ranks for a second and agree with you on a point about buying into the hyperbole that is when the ACHA was first posited. You say I've seen this sort of media campaign of my pre-existing condition, right? That I'm going to be denied coverage because of my pre-existing condition, and that wasn't. To me, is my perspective. And again, if anyone sees this or hears this and has objections from the left and they want to come after me for it, that's fine. I'll listen. That it was not an intellectually honest way to approach that, because the idea was that some states would have the option to opt out. Whether or not that was going to be a thing was A, unknown, and B, that for anybody else, you weren't going to be denied coverage based on having pre-existing conditions, which is, I think, the one thing everybody could agree was one good thing about Obamacare, is that you can no longer be denied because you have a pre-existing condition.
Right.
That wasn't really going to be necessarily the issue. The problem was that they could ramp up costs on you because you had a pre-existing condition, and you'd be kicked off insurance because you could not afford it, not because they were telling you no. And and very much the presentation of that was you were being told no. The end result might be the same, but the avenue was different, and I sort of objected to that from the beginning. And so that was my thought on that. Again, if somebody wants to say I've got that wrong, please challenge me. I'm very much willing to listen and revise my position. But that was my takeaway from that. So there was a point of agreement there, Melissa.
Okay. But occasionally we see eye to eye, you know.
Right, and that's the idea. That's, you know, fermenting opinions. It's a call to come back to the table, you know, and talk and recognize that, you know, there's common interests between us. There's some common humanity between us. You know, they're saying healthcare is something everybody needs. This is something we all have to have in our lives. How do we do it? And, you know, at the end of this conversation of, you know, an hour plus now, we don't have an answer for anybody, unfortunately, which sucks. But, you know, we didn't come here to solve all the problems necessarily of the world in one conversation. But the point is to have the conversation so we can get to those answers. And with that, did you have anything else you wanted to add?
No, I think we've had a good discussion. I've enjoyed it. Yeah,
it's I enjoyed it too. This is remarkably amicable for a lefty and a righty, primarily talking about healthcare. No one has made, you know, accusations against the character of another, which is a rare and wonderful exception of the norm. But with that, Melissa, thank you very much for joining me. Thank you, Lace, for being here.
Pleasure. Thank you, David.
Before your connection crapped out on us. I'm David Poseidon, and this is Fermenting Opinions.
Good night.
Till next time.